Hello, everyone. This is Dr. Shalom from Chem Health and Diagnostic Center. It's good to have another time to share with you some information that I have. Now, a few days ago, it was the World Hepatitis Day, and there's a lot of information about vaccinations. Prevention is always better when it comes to hepatitis B. Today, I want to make a video to share with you some information for those of you who may be hepatitis B positive or reactive. It doesn't mean that your whole world has come to an end. I know you've heard this a lot of times, but I want to give you some tips on what you should do next. So, if you go for a test, you did a screening and they told you that you were hepatitis B positive or reactive, what is the first thing you need to think of? What do you need to do? First off, this is how that virus works. From the very first time that you get infected with the virus, it doesn't mean that you are, on your way to your grave. No, what it means is you have a period of time where your body needs to do everything it can to eliminate the virus. Have you ever heard of people who did a test and they found out they were positive and then they went to take some kind of herbal concoctions or some kind of things to take, and from positive they became negative? Let me tell you how that works. As soon as you get infected with the virus, now science tells us that you have about 6 months of the acute window where your body has the ability to get that virus out of your system. So it's very possible to be tested positive, and after a while, you do the test again and it's negative because you are in that period. So the first thing is, don't panic. If you are tested positive, don't panic. Don't run around, start taking different things and try to do. Everyone comes up with a cure. Well, for now, we don't know that there is a cure. There may be, but it's not yet open to everyone. So the next thing you need to do is start seeking help. And the best person to speak to is a medical doctor who has been trained to understand the physiology, the pathophysiology of how this virus works and what you need to do. There are a group of tests you need to run, and then there's going to be some examinations you need to go through. That will help you decide what your next step is. Another thing, hepatitis B infection does not mean you need to start taking medications. Okay? There are some tests, I'll tell you the basic ones you need to know. Number one, liver function test. You need to do that. What does that help us see? It helps us to see how good your liver is working. You have two parts of the liver. It eliminates toxins and it synthesizes proteins. Is your liver doing that very well? That's the first one. The second one is called hepatitis B viral load. For the fact that you did a test and it says it's reactive or it's positive, you need to know how much of those copies are available in your blood. That would help the physician determine what kind of treatment you need. The third one is called hepatitis B viral DNA, or some people call it a 5-panel test. That tells us the structure of the virus. It lets you know if this virus is actively replicating. It lets you know if you are infectious. It lets you know if you are getting into the chronic stage of the viral infection. All right. The next one is a scan. You need to scan your liver. There are other tests that need to be done depending on the stage where you are, any symptoms you have. Remember, not everyone has symptoms, so it is important to know that. If you're able to do these tests and have a very good physician who is experienced to explain to you what these tests mean, that's already your first step towards managing that condition. Remember, it is not a death sentence. It just means that you need to be very careful. What is the danger of hepatitis B? It can go into a chronic stage, leading to liver cirrhosis, leading to even HCC. We call it hepatocellular carcinoma. That is a cancer of the liver. So a lot of people are having cancer of the liver, and a lot of it is connected to a chronic hepatitis B infection. It is important for you to take note of all of these. What else can you do while you're running these tests? And some people may need medication, some people may not. What else do you need to do? Watch out for the food you're eating. Protect your liver. Stay away from alcohol the best way that you can. Stay away from medications, randomly taking different stuff. A lot of people offer you different kind of drugs, telling you that it's a cure, it is this, it is that, but you don't do that. Talk to your physician first and speak to your physician about your concerns. If you've heard about some supplements, speak to your physician. Ask him, is this good for me or is this not good for me? Do the best that you can to protect your liver, because there are a lot of people who have hepatitis B, they're not infectious, and they're living a very happy life because they know what to do and when to do what to do. So take a decision today. If you or your loved one has been found to be hepatitis B positive, take the necessary steps to protect yourself and extend your life. Thank you. And I hope that you'll make the right decision. Have a great time. Bye.